following the recent health conference held in Jos on April 15 to May 1, 2021. The president of the Nigerian Medical Association, Professor Dr. Innocent Uja, on 12th of May 2021, held a press release stating the progress and response from the past conference. On his note, he stated that several dignitaries such as the Honorable Minister of Health, Minister of Women Affairs, Dame Pauline, the pioneer DG of NCDC, Professor Abdulsalam Sidi, and others graced the event, which was kicked off by several humanitarian activities. The conference, titled Nigerian Global Health Agenda 2030, was set to involve discourse of major health issues, observation, resolution, and suggestion to help shaping the health sector of the nation. Major among the discourse of the day is the appeal to federal government on revamping local vaccine production and commemoration of welfare matters of health workers, as well as investing heavily in the maintenance, salary, and entitlements of the health workers. During the conference, the committee commended the Presidential Steering Committee on Covid-19 on the recent issue in the National Travel Advisor and follow-up with institution on restriction, all aimed at protecting against the third wave of Covid-19. Also urging fellow Nigerians, medical and health workers to go for the Covid-19 vaccines to help eradicate the spread across Nigeria.
The conference noted with deep concern the epidemiological triple jeopardy of existing infectious diseases, emerging infections including the ongoing pandemic, and the ticking time bomb of the non-communicable diseases. Therefore called on the federal government to lead in mobilizing states and governments to garner the highly needed political will, financial resources, partnership, and requirements to rejig its emergency plans, preparedness, and response to pandemic, appropriate funding for existing health institutions and services, as well as adequate provision of welfare and conducive work environment for doctors and other health workers. The ADN resolved to continue with the high-level advocacy for the improvement of access, quality of healthcare services, and financial risk protection that will guarantee the attainment of universal healthcare coverage, which we call Agenda 2030, so that no Nigerian is left behind in healthcare delivery system towards achieving the Sustainable Development Goals. The conference commended the Presidential Steering Committee on COVID-19 on the recently issued International Travel Advisory and followed up with the institution of restrictions, all aimed at protecting against a third wave of the infection. In its contribution, the AGM further appealed to adult Nigerians, especially medical and health workers and persons with comorbidities, to go for COVID-19 vaccination, as it has been clinically demonstrated to be safe and effective in reducing infection rates. The conference, taking cognizance of the fact that Nigeria had demonstrated capacity in vaccine production against yellow fever in the past through the Federal Vaccines Production Laboratory, YABA, was stopped in 1991 for several reasons, strongly appealed to the federal government to spare no efforts at ensuring the success of the renewed initiative with the inauguration of the Bio-Vaccine Nigeria Limited, a joint venture between the federal government of Nigeria and May and Becker Nigeria Limited. The Nigerian Medical Association would be very pleased if the initiative sees the light of the day, so as to reduce the over-dependence on other countries and achieve self-sufficiency in vaccine production. The conference acknowledged the report of the Remuneration and Welfare Committees as it concerns hazard allowance, retirement age, specialist allowance, and urged government to expedite action to conclude the process in order to forestall any further disruptions of services in the public health sector.
Zainab Ahmed, Voicetv, Nigeria.